Morbid obesity is a chronic condition characterized by a body mass index associated with metabolic, respiratory, and primary cardiovascular complications. Its prevalence has increased alarmingly in recent decades, becoming a challenge for health systems and interdisciplinary teams. One of the central points of the article is the difficulty of applying conventional diagnostic tests in people with morbid obesity. From a physiotherapy perspective, this diagnostic limitation becomes an opportunity applying practical clinical tools such as the 6 minutes, the 6 to stem test, and dyspnea scales provide valuable information for planning the intervention. In addition, monitoring oxygen saturation and heart rate during exercise is essential to ensure patients suffer. The article emphasizes that therapeutic intervention shall not be limited to weight reduction alone, but should focus on improving overall cardiovascular health. For cardiovascular physical therapy, this involves design individualized programs with a gradual approach. Aerobic training should begin with low-impact activities. The progression of the program is based on clinical response, hemodynamic parameters, and perception of effort, which requires constant monitoring by the physical therapist. A critical aspect highlighted in the article, and one that deserves consideration, is the heterogeneity of the morbidly obese population. Not all patients respond in the same way to intervention programs, which is why personalizing treatment is essential. At the same time, it is clear that physical therapy should not only focus on physical rehabilitation, but also contribute to patient adherence and emotional well-being, working on with physical.
Traumatic brain injury, TBE, is one of the main public health problems due to the high incidence, mortality, and severity. Although historically the focus has been on primary secondary brain damage, recent research shows that extracranial complications, especially cardiac ones. Myopathy, the pathology is complex. The catecholamines, stroke, and cytokines release general and overall of cardiovascular system that can culminate in reverse heart failure. Clinically, these alterations manifest as changes in the electrocardiogram, blood pressure fluctuation, and signs of hypoperfusion. Although in many cases they are transient, early detection is essential to avoid major complications. Intensive monitoring using ECG, echocardiography, and biomarkers is the cornerstone of approach. Among therapeutic strategies, blockades have shown positive effects by reducing myocardial oxygen demand and stabilizing heart rhythms. However, the routine use still debate to risk of hypertension and the lack of conclusive studies. In conclusion, TB is not a neurological problem but also a condition with a systemic repercussion in which the heart plays a central role. Understanding the brain and heart interaction opens the door to more comprehensive and personalized treatment. The future challenge lies in conducting clinical studies to validate intervention that improve both survival and quality of life for patients.
Revascularization in patients with reversal coronary artery disease and chronic disease coronary artery bypass therapy versus precaution coronary intervention. Shorted kinder research in and work published this channel, but its prevalent estimated and approximately people working with and is significant cardiovascular implication in as we document that near two-thirds of patients with have coronary artery disease. Market cut daily causes of mortality in the popular. They manage of the patient with post complex therapies dilemmas as the third option. Pertinent coronary intervention of coronary artery bypass granite have particular benefits and reach what much of carry with it. Therefore, several studies have shown that in general population with universe diesel submerged revascularization of long-term advantage of PCE to lower mortality. Fewer myocardial intervention and less net for revascularization of where patients inter are historic cash underpair growth and clinic trial will limit the spread of recompense in population. They record student coding in Alberta, Canada, produced evaluation being analysis the results of their patient wing under 3 vessel disease with under week 4 of excel of 10 years with fish que compare what summer revascular is associated is lower thunder mortality as lower rate and infarcted it repair revascular warped with in contrast not significant difference of in short rate or well hospitalization rate there I wish expect its espace. The thing then bears observed with share of passing in students where there this refresh in clinic therapy of the favorless in vaccine products in individuals with it comorbid and peppery power as is the case, however, is patient my comparisons net to regular clinic disease market were more individual and multidisciplinary model. Then analysis is inventing concept of the therapy part of it is growth of patients with half of the V let go in pericardial reach as renal vulnerability in indicates. The importance of preventive renal protection strategy of the optimizing peritoneal care and self-appropriate country in of the balance of benefits. Thank you.
Therapy in patients with multivessel coronary artery disease. Cardiovascular disease is one of the main causes of death worldwide, and managing multivessel coronary artery disease is especially challenging because of its complexity and cost. This article compares three common treatments: CABG, PCE, and medical therapy. What I found most interesting is how the study not only looks at survival but also at cost effectiveness over time. The results showed that CABG provided the best outcomes with higher survival rates and better quality adjusted life years, making it the most cost-effective option in the long run. PCA will less invasive and cheaper at first, often repeat producers, reducing its long-term value. Medical therapy, although initially the least expensive, had the poorest survival outcomes, proving to be least effective. I think the most striking point is that CBG, even though it costs more at the beginning, and of being more economical with analysis over several years. This study highlights the importance of thinking beyond short-term saving in healthcare. Choosing cheaper options at first may actually result in worse outcomes and higher costs later, and it also shows that the decision should not be based only on cost but also on patient needs and prefers, since some may still prefer less invasive approach. Overall, the article reinforces the idea that investing in treatment like CBG, which provide greater long-term benefits, is the best way to improve patient outcomes while making better use of healthcare resources. Thank you.
And promote robust approach of embolization and reinforcing the need to implement therapeutic measures that ensure both venous recognition and the prevention of future thromboembolic events. Therefore, choosing the most effective treatment is central to resolving the disease. Clinical guidelines and five-step configuration is the cornerstones of deep vein thrombus management. Among the variety of options, direct oral anticoagulants have demonstrated significant advantages over warfarin and low molecular weight heparin. Their benefits include fixed dosing, no need for routine monitoring, and reduced risk of intracranial bleeding. These factors translate into a greater safety, adherence, and better clinical outcomes. In conclusion, proper treatment of the vein thrombosis not only mitigates the immediate risk of pulmonary embolism, but also prevent chronic sequelae that impair the patient quality of life. Evidence indicates that direct oral anticoagulants offer the best balance between efficacy, safety, and convenience. The making therapy strategy that contributes most to effective resolution of the disease. Adopting this approach in accordance with international guidelines guarantees better clinical outcomes and in an essential step toward excellence in vascular care. Thanks.